Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. As you know, with our aging population, the incidence of Alzheimer's disease is increasing quite rapidly. And there are a variety of blood tests and other tests that may help to identify people who are at risk for this disease, but no one test has been established as the gold standard. And some of the tests are quite invasive, such as drawing out fluid from the spine's cerebral spinal fluid with a needle, which wouldn't be fun to undergo. So the study published in June 6, 2024 in the journal Nature Mental Health appears to be a true game changer. Now, reporting on subjects who are part of the large UK biobank study, the study utilized functional MRI of the brain, evaluating over 1,100 subjects. The average age of the subjects was 70.4 years of age. Now, using a machine learning tool to look for specific changes in the brain region known as the default mode network, the learning tool was able to identify with 82% accuracy which subjects would develop clinical dementia over the next 9 years. So they did this assessment using functional MRI of people's brains, and the machine learning tool could predict with 82% accuracy which of these subjects over the next 9 years would develop dementia. So the baseline functional MRIs were performed between the years 2006 and 2010, and by the year 2024, the researchers had their results. The great thing about this is that functional MRI of the brain is non-invasive, and there's no radiation exposure. Now compare that to other early detection procedures where they have to use needles, where there's risk of bleeding or infection, or you could puncture a nerve. There's no radiation damage as would occur, say, in doing mammograms. There's no risk of puncturing or rupturing the colon, as can sometimes occur during colonoscopy. So it really is risk-free. However, the question remains, what do you do if you see changes on the MRI that suggest a high-risk future dementia risk? Well, the FDA just approved a new drug called donanemab that helps to break down plaque and was shown to slow early-stage Alzheimer's disease progression by about 30%. So that's great. But it's not a cure, and there are some serious adverse side effects that can occur with this drug, such as brain bleeds, because it's given with IV administration, and for some people they don't tolerate it well, and there have been some reports of people having bleeding into their brain causing death. So it's not completely safe, but it is encouraging that they have a drug like this. So it still comes down to nutrition and lifestyle practices that give you the best chance of not developing dementia and Alzheimer's disease in the first place. So let's quickly recap what those strategies include. Number one, keep your cholesterol level down. Your total cholesterol, if possible, below 3.9 millimoles per liter, and your LDL cholesterol below 1.5 millimoles per liter. Now, this can be accomplished in most cases just by a prudent diet and regular exercise, but you should know your numbers. Also, keep your fasting blood sugar down. Your fasting glucose should be under 5 millimoles per liter. Remain at or near your ideal body weight. Avoid brain-damaging chemicals like cigarettes, but also, too much alcohol consumption and other recreational drugs. Keep your brain active and engaged throughout your entire life. Keep learning new things and, developing new skills as best you can. Avoid head injuries. Wear a helmet when you're doing certain kinds of sports. Keep your blood pressure down around 120/70. And participate in regular exercise, very important. And try to drink some green tea every day if you can. Now, regarding supplementation, I suggest that you do this. Take a high-potency multiple vitamin every day that contains a B50 complex and is enriched with extra antioxidant protection, as well as at least 1,000 IUs of vitamin D. I would also take an essential fatty acid supplement that contains fish, flaxseed, and borage seed oil. At age 40 and beyond, I would start using a supplement that contains some melatonin at a dose between 0.5 milligrams up to 3 milligrams. Take a dose that helps you get a good night's sleep but doesn't leave you groggy in the morning. And then at age 55, I would take a supplement. I would add a supplement that contains CDP choline, phosphatidylserine, bacopa monnieri, and huperzine A, because these four nutrients work together to help maintain optimal levels of the brain's memory chemical acetylcholine, which typically declines after the age of 55. You want to maintain optimal levels in the brain of the brain memory chemical called acetylcholine, and those 4 nutrients have been proven to help you do that. CDP-choline, phosphatidylserine, huperzine, and bacopamoneary. Okay, I've provided a link to the research paper that explains the breakthrough dementia detecting functional MRI study I reported on in this update, as well as a link to the FDA approval of the drug donanemab. So thanks for watching, and I encourage you to employ the nutrition and lifestyle medicine strategies shown to protect your brain against the development of dementia as best you can. So thanks for watching. I'll see you next time.